Okay.
Yeah.
So now let's zero in into the main thing itself. You know, yeah, what it is and how does it come?
So as we've said early on, it's an autoimmune condition.
Yeah.
Affects mainly the joints, the small joints, and sometimes the large joints.
When you say the joints, which joints?
So the joints, I'm talking about the small joints of the hand.
Okay.
The small joints of your feet.
Okay.
So sometimes your elbows, your knees. Yes, so mainly, but it can affect any other parts of your body. Okay. And it's as a result of the cells, which is the antibodies, attacking the joint spaces and then the coverings around the joint. So for every joint, where the two bones meet, there's a cartilage which covers the bone.
Okay.
So it's like a pad, covers the bone. And then there's a membrane which goes around that. So when the antibodies attack the membrane, which is the covering
around,
exactly, then you have the symptoms. Okay. So maybe that is the disease process. So people will present with painful joints, especially in the morning when they wake up. So they might complain of stiffness when they wake up in the morning, which gets better as the day goes on. So like for the 30 minutes when they wake up, they have the joint pain, joint stiffness, and then swelling. And sometimes they are generally fatigued. Okay, so that's the disease process. And the disease process leads to the symptoms. So Safako will tell us about how she feels so that we put everything in context.
Yeah. So Safako, Doc mentioned that, I mean, this is what you're going to be feeling, and then it progresses into something else. In your case, how long did you start getting that, you know, and how did it happen to you?
Well, I was diagnosed in August 2015. Yeah, so that was when I was diagnosed with the disease. So it started with joint pains, fatigue. In fact, you feel very tired. You can't do anything. So it's you know, the disease is invisible. So it's invisible, so you are fighting. So you outside, you don't see what I go through. But I'll complain that I'm having pain here. And people are like, but you look fine. So why are you complaining you are not well? But the thing is inside, you know how you are feeling. Yeah, so it's not something really cool.
The symptoms you're talking about, was it the initial stages that you started feeling that way? Or it comes this one comes today, the other one adds up? Or you just woke up one day and you started feeling the stiffness and the pains and all that?
Well, it started with knee pain,
okay. So you woke
swelling,
up and you were not able to stand.
Yes, you can't stand. And then you need somebody to help you because you feel stiff. So I didn't know what was going on until I went to the hospital. And the doctor, I was fortunate that I got a doctor who said, oh, I think I know your condition. I'll refer you to the rheumatology department. And that was where I was diagnosed. So I was very fortunate that I got diagnosed early. So that is it.
This was between what time in terms of when you got diagnosed?
Yeah, I think it was around a year.
So you had experienced that condition, the symptoms for a year?
Yes, and I had to use walking sticks at times to the office.
Wow. And that is even yours being diagnosed early.
Yeah, because I have, my leg is swollen, my knee is swollen, I can't walk, and you have to go to the office. And if you stay home and you said, I'm sick, it's like you don't want to come to work. Yeah. So you are forced to go to work. So I had to use the walking stick to go to the office, climb the stairs. And then
you're not even old, 70-year-old already. You're using walking sticks.
You see old. So I have to use the walking sticks for some time. So I was just doing it in and out till I went to the rheumatology department. And then the doctor said, okay, I need to do some labs to confirm. But then before she looked at my joints, she started touching it to just feel. So she said, okay, I know what this is, but let's run the test. So it came out rheumatoid arthritis. I was seropositive. So that was what came out. So that was when...
Okay.